We're the Cedar Elves. I'm Catherine Casampino.
I'm Deirdre Devlin.
I'm Andrea Fortunato.
I'm Morgan Fulmer.
And I'm Erin George.
Our presentation is on the effective interventions to prevent nurses from utilizing electronic medication administration workarounds. That is when you're in the hospital and we all have used the barcode system, people try to go around that system so it's not used effectively. This poster summarizes why nurses bypass the barcode medication administration system, which will now be referred to as the BCMA system, and ways to prevent these bypasses.
The introduction of the poster highlights the following facts. Errors in the process of administering medications are the most commonly documented cause of patient adverse events in hospitals. As nurses, patient safety has to be our #1 priority, and reduction in any sort of adverse patient events should be a top priority. As nurses, we are identified as the last line of defense in preventing these medication errors. So an increasing number of hospitals have turned to BCMA systems to add an extra level of security for patients. Added technological advancement creates more opportunities for nurses to bypass these systems and increases the likelihood of medication errors. For the significance of the problem, research has revealed that the implementations of BCMAs are strongly recommended for all hospitals, since medication administration errors are so prevalent, so seldom intercepted, and so final. With BCMAs, there are still a substantial number of workarounds that are performed by nurses. Sometimes the barcodes don't scan or it takes too long and they just override it manually. So a workaround is technically considered to be when the nurse administering medications using the BCMA system deviates from the defined workflow.
This brings us to our clinical question. What are the most effective interventions to prevent nurses from utilizing electronic medication administration workarounds? We then conducted a literature search here at Cedar Crest College in the library. We used Sage Publications, Google Scholar, EBSCOhost, and PubMed. We also limited the articles to full-text peer-reviewed that were published between the years 2006 to present. We used variations of keywords like nursing, barcodes, workarounds, medication administration, and medication safety that were used.
We then came across 5 articles that would appropriately answer our clinical question that Andrea previously stated. You can view each article in more detail with the synthesis of evidence section in our poster that we will be posting for you. After reviewing the publications, we did note common themes throughout the articles. These themes discuss ways to prevent nurses from utilizing workarounds with the BCMA systems. And some of these recommendations included nursing acceptance with the BCMA product, i.e. battery life longevity, proper wireless connectivity, the size of the cow, which is the computer on wheels, and the portability of the cows. Nurses must maintain a positive relationship with the vendor to individualize the product. Nurses should also be involved in the design, the implementation, and the selection of the program that they're choosing to use. And nurses should be educated before and after the system is implemented. The organization should be continually monitoring to look for enhancements and upgrades on the system that they chose.
And after looking at the recommendations, we created implementations that would prevent nurses from utilizing the workarounds with the barcode systems. And some of them would be to create a multidisciplinary team to pool ideas about medication mistakes, because it's been shown that nurses are more likely to abide by the system if they are the ones that are involved in creating it. Replacing the barcode printer in the pharmacy also resulted in fewer scanning errors because the barcodes were printed correctly or not wrinkled when they were on the medication. And education also plays a vital role in adherence to the proper use of the BCMA systems. In conclusion, even though technology has made exponential advancements in the medication administration, there are still user compliance issues and workarounds that compromise the 5 rights of medication safety. Research has proven the possible dangers resulting from BCMA workarounds and has suggested recommendations to avoid bypassing the systems. Continuous efforts by the multidisciplinary teams, especially the nurses, to maintain compliance with BCMA protocols needs to be a top priority in order to maintain patient safety.
Thank you very much for your time, and we look forward to answering your questions and addressing your discussion points.